Yes, well, you can say it like without the H, so like Rita, R-I-T-A.
Or
Rita
Ritha
Belizaire. Yeah.
Belizaire. Okay.
Yes.
All right. Are you ready? Let me know when we're
Ready.
live. Oh, we're live. Okay. Hi, everyone. Good morning, good afternoon, good evening, depending on when and where you're watching this Facebook Live. This is the voice and the face of Dr. Olabintan. I'm the CEO and the co-founder of Livingspring Family Medical Center. Yay, in the awesome city of Mansfield, Texas, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. I'm excited to be here again. Yes, we started late, but we are here. If you are live, hashtag live. If you're watching a replay, hashtag replay. But I'm excited today to be talking about the topic, bye-bye hemorrhoids, tips to managing it and relieving discomfort. And we're doing so with none other than Dr. Ritha Belizaire. Hi, Doc. How are you?
Hi, I'm good. Thank you for having me.
Thank you for hanging in and not leaving. Thank you for
No,
doing
I no,
this.
I would never. I would never. A fellow Texan. Keeping Texas relevant.
All right, awesome. Thank you for doing this. I'm sure our viewers are going to get a lot of helpful tips to help them get a little more comfortable when it comes to the tush. So, yes.
Yeah.
Uh,
Definitely so.
all right, that being said, can you kindly introduce yourself, Doc? Who are you and what do you do?
Yes, absolutely. So my name is Dr. Rita Belizaire. I'm a dual board certified general and colorectal surgeon. I practice in Houston, Texas. I am the owner of Houston Community Surgical, my solo surgical practice that I just opened in July. And I treat patients with general surgery and colorectal surgery problems. So we can kind of go over what all those are, but essentially things in the abdomen. So gallbladders, small intestines, appendix, from a colorectal side, anything with the large intestine, the rectum, or what we're going to talk about today, perianal disease, hemorrhoids, and things like that.
All right, so I mean, I got to know too. Why do you do what you do? What's what was the obsession with the gut?
Well, so the funny answer, I feel like I've said this to a couple people, so it's going to probably stop being funny and start getting stale. But I learned this from one of my my fellowship attendings when she said people would ask her why she chose colorectal surgery, and her answer was there was an opening.
That was
The
good.
real the real answer though is I graduated general surgery residency, and during general surgery residency, you see a lot. We do a wide breadth of learning,
Right.
anywhere from like vascular, thoracic, thyroid surgery, things in the abdomen, abdominal wall, soft tissue, all of that. And my first year out, I was doing essentially emergency general surgery, so people that would come through the ER. And it did get a little bit stale. It was like always the same thing, dead gallbladders or perforated somethings.
Right.
I felt like as a general surgeon at a big institution, things were kind of getting taken away from me. And when I started seeing like colon cancers were getting taken away because they were getting sent to a specialist, obviously, I was like, well, I'm not ready to like give up those things. So I chose a fellowship that was short, so only 1 year, that was operative, meaning that I would be doing a lot of operating, and that would coincide with a lot of general surgery diseases, because I still really liked being a general surgeon, and colorectal surgery lent itself to that. So I like to think of myself as a general surgeon that's got like expertise in colorectal diseases.
All right. Awesome, awesome, awesome. Now, let's talk hemorrhoids. All right.
Okay.
What are they? Sometimes people feel like part of their bowels are falling out, and they're scared. Like, oh my God, I felt something. But what are hemorrhoids, and what generally causes them?
Sure. So, a fun fact that a lot of people don't know is that hemorrhoids are normal. Everybody has them. Everybody's born with them. So it's a normal part of our anatomy, and it's part of the continence mechanism. So, when you have that urge to go to the bathroom, number two, and you're able to hold it in, there's a whole mechanism behind that, and hemorrhoids are part of that mechanism. So we're born with them. What makes hemorrhoids enlarged, or what makes them symptomatic, is a number of things. Most of the people that I've seen have either had a baby in their uterus, they've been pregnant once before, they have constipation and do a lot of straining or they do a lot of sitting, like truck drivers. But essentially, it's gravity and pressure on the, on the anal rectum, right? So if you sit on a toilet for a long period of time and you're straining and sort of gravity is pulling down on that area, it's like a varicose vein, right? If we stand up for too long, our legs get heavy and maybe a little swollen. It's sort of the same thing with hemorrhoids. So that's what kind of causes them to become enlarged.
Okay. And what are the common symptoms? Like, how do you know you have a hemorrhoid?
Yeah. So, there are essentially two symptoms that we hear of. There are three symptoms that we hear of patients with hemorrhoids. Number one, bleeding. That's number one. And, depending on what kind of hemorrhoid it is, generally internal hemorrhoids bleed. You can also feel pain. So pain, most of the time, general rule, comes from external hemorrhoids. They can also come from internal hemorrhoids, but pain and bleeding. And then people often describe itching. And I don't know if that's from swelling and like stretching of the tissue, or if there's like moisture on the perineal skin or what. But pain, bleeding, and itching tend to be, and then that they can feel something that's bothersome to them. Right. Those are usually the symptoms I hear about with hemorrhoids.
Okay. Thank you. Now, someone's watching like, yeah, doc, I'm glad you like to, do surgery and do the things, but before I have to get to you, are there like at-home remedies or over-the-counter treatments that you typically would recommend? Now, of course, these are medical suggestions. Please make an appointment with your own doctor to come up with a plan that works for you. But are there at-home remedies that you would recommend that could provide some relief pending an appointment with you?
Sure. So, the biggest thing is prevention. So what we say is, toilet hygiene. So don't sit on the toilet for too long. Don't flip through TikTok for too long, listening to your favorite doctors giving you great advice. I used to say don't read the magazine on the toilet, but I don't think that's a thing anymore. So, but essentially toilet hygiene. So prevention is the biggest thing. But if they're kind of already there, high fiber diet, fiber supplementation, kind of bulk the stool, soften the stool so you're not sitting there having to strain for a long period of time, and then you're not having hard stools passing through there. That can also irritate them. And then, there are a couple over-the-counter medications that would use to get relief, because it'll say it's relief from pain and burning and itching.
Okay.
Essentially, what's in a Tux pad is witch hazel. Can you still hear me?
Yeah, I can hear you.
Okay, yeah. So essentially what's in a Tux pad is called witch hazel, which is not exactly, but kind of like rubbing alcohol, but it like kind of like soothes the area. But that can cause a contact dermatitis. So basically like itching of the skin and irritation of the skin. And oftentimes people will think that that's because it's not clean or something like that. So we'll use more and more and more, and it causes more itching. So Tux pads are really not my favorite. If people use them, does it mean that they can't be treated otherwise? No, but they're not really the greatest for the treatment of hemorrhoids, because you can then give yourself, itching of that perianal skin. And then, there's preparation H. Essentially, that's a medication called phenylephrine, which is vasoconstrictor. So what a hemorrhoid is it's this cushiony tissue, like a spongy tissue, with a bunch of blood vessels in it, which is why they bleed. And so with the idea with the phenylephrine, the preparation H, is that you apply it to the hemorrhoid, it makes those blood vessels constrict, and then makes the tissue less swollen. It's not going to hurt anybody to use it, but it's generally not. It's not a good long-term solution for hemorrhoids. The other thing is you can sometimes get over-the-counter hydrocortisone at lower strengths, and sometimes that can help shrink the hemorrhoids. When they're the lower grades, like grade 1, maybe even grade 2, the smaller hemorrhoids, that may help with the hydrocortisone cream can sometimes help over-the-counter.
Okay. Now, when should someone actually consider medical treatment? So by medical treatment, I mean seek their primary care to refer to you. Like what are red flags? Like, okay, this is time to go get help.
Yeah. So if you're having a lot of bleeding, GI bleeding, then usually patients will come before it becomes so much, right? Yeah. Because we hear like any blood in the stool, cancer until proven otherwise,
Right,
which
right.
most of the time it's not. But so bleeding tends to bring them in before, they're, wondering if they should come in. But excessive bleeding, specifically if you've had to go into the hospital, certainly receive a blood transfusion, and that does happen in patients that have certain, size hemorrhoids that they've had to be hospitalized and receive blood transfusions. That's a rarity. But yes, if you have a lot of bleeding, anytime you have, discomfort or pain or hygiene issues, sometimes they'll have a hemorrhoid that's so big that it's prolapsing out or protruding out of the anus itself. And then people feel like, okay, I have a bowel movement and I'm wiping and wiping and wiping and wiping and wiping, and things aren't getting clean, and then it's irritated and then it's bleeding from that. That's another reason to seek medical advice.
All right, you heard the doc. There's a time where you need to go get help, okay? All right, next question. Are there any specific exercises or stretches that can help with the hemorrhoid discomfort?
Not really.
Like,
No,
a little
because,
stretch on the one cheek.
No, I mean, there's a whole topic of pelvic floor dysfunction, and
Okay.
a lot of people that have pelvic floor dysfunction may also have hemorrhoids, but there's nothing with like pelvic floor physical therapy that's going to fix the hemorrhoid.
Okay.
Once it gets to a certain size, we grade internal hemorrhoids, grades 1 through 4. Grade 1 is a little bit swollen but doesn't protrude out of the anus. Grade 2 is swollen and it protrudes out of the anus, but it puts itself back in right after you have the bowel movement or whatnot.
Okay.
Grade 3 is it protrudes out and you have to manually push it back in for it to go back in. And grade 4 is it protrudes out and you can't even get it to push back in. So the earlier grades, medical management can help, but once it gets so big, grade 3, grade 4, certainly grade 4, medical management won't help. And there are truly, to answer your question, there's really no physical activity that can help the hemorrhoid go away, except for, I guess, staying off the toilet for long periods of time. That's really the biggest thing.
Okay. Now, are there any foods or dietary changes? I know you alluded to them earlier that could help with hemorrhoid management.
Fiber. Oftentimes we'll see a patient, they're like, I'm bleeding a lot, or I feel my bowels coming out, or something like that. And it's maybe an early grade 2 or something, and they take fiber, and the bleeding and the prolapsing stops. So high fiber diets are just make your colon and rectum and anus healthy. Happy. So it's implicated in decreasing the risk of colon cancer, rectal cancer. It's just you can never go wrong by eating fiber. There are many different kinds. That could be a whole other conversation. But high fiber. But otherwise, there are certain foods that may make people, either get constipated or have diarrhea, or, sometimes they say like spicy foods can contribute to the itching. Spicy foods or acidic foods, like if people have what we call anal pruritus, which is itching around the perianal skin.
Right.
Sometimes we'll, say, okay, try this elimination diet. It's not a diet I would want, but reduce coffee, chocolate, alcohol, and then acidic foods like tomatoes, things like that. So, you can try those things, but just truly a high fiber diet is really kind of the best thing.
I need you to explain, because, what is high fiber? For those who are watching who are like, well, I eat a lot of bread. Bread has fiber in it. So I want you to
the best things are sort of plant-based, right? Legumes, beans, vegetables, leafy green vegetables are high in fiber. But other things too, like avocado is actually high in fiber. What else? Other things that are, like I said, beans, fruits can be high in fiber. Things like that. Yes, breads can be higher in fiber. Yes.
Good quality bread, yes.
Yes. But like whole grains.
Whole grain, yes.
Like certain of the like whole grains, that can be those can be pretty high in fiber as well.
All right, awesome. I love the emphasis on plants. So I didn't tell her to say that. She said it. She said plants.
I know. I need to be much better. Like I don't always practice what I preach, but when I can, this is the thing. This is the thing. You're not going to go from eating like a steak every night to eating only plant-based.
Right.
But anytime you can choose to either add a plant-based something or other,
Yes.
or substitute a plant-based something or other.
Just
That's a
add
start.
it. That's
So,
it.
yeah.
That's it. All right. Thank you, Doc. All right. Next question. Is there a way to permanently rid oneself of hemorrhoids? Some people are concerned, I have it. Will it come back again? What's the point taking it out if it's going to come back? What would you say to that, Doc?
So, a couple of things. So, there are several ways you can remove hemorrhoids.
Okay.
One of them, the least invasive way, nobody would say this isn't invasive, but on a surgical spectrum, the least invasive way is putting a rubber band at the base of it. So it's called a rubber band ligation. You do it in the office, you're awake, it's not comfortable, but it doesn't hurt. You essentially put a band at the base of the hemorrhoid, and then in 5 to 7 days, it falls off and that area scars in. Okay. Those are really for grade 2, grade 3 bleeding hemorrhoids, but otherwise not too symptomatic. Now those, because sometimes you don't get the entire hemorrhoid, you can get hemorrhoidal disease back in that area, right? So, but it can be long lasting if you ban the hemorrhoid. There's not really any other hemorrhoidal disease. You start with a high fiber diet and all of that, some dietary changes, some toilet hygiene. It may not come back, right? But it can with rubber band ligation. When you do a surgical hemorrhoidectomy, you're taking out that entire cushion of tissue, and suturing it, and then that scars in. It's never going to come back in that area. Never. Other parts of the anus, like there are essentially what we call 3 different main columns of hemorrhoids in the anal canal. So when you take out one, that one is never going to come back. Can the other 2 then get swollen? Yes, of course. But when you take it out with a surgical hemorrhoidectomy, that one is gone for good.
Okay. All right, this is awesome. This has been a lot of information, a wealth of information as well. But my final question before we wrap up is to ask, for someone who's watching who's like, yeah, I have hemorrhoids, I'm a little nervous about going to see my doctor, what would you say to that person, maybe to nudge them to maybe get the help they need, Doc? Because it's about their hiney, so people are very sensitive.
No, it is a sensitive area, and certainly you want to feel comfortable with the doctor that you are talking to.
Yes.
Just generally speaking, but certainly when they're not, talking about sensitive areas. But, colorectal cancer screening has undergone a bit of an evolution in 2021. The screening age for all comers used to be 50 years old,
right?
And now it's 45. And in some populations, this is my opinion, you could even argue to make it even lower than that. So we're seeing colorectal cancer in much younger and younger people. So this is tangentially related to hemorrhoids in that if you're having any symptoms of your GI tract, of which your anus is included and is part of it. So if there's pain, if there's bleeding and discomfort, it's better to get it checked out and find out it's just a hemorrhoid, rather than get it checked out and it's something that you don't want it to be.
Right.
So, and then the other thing I tell people, I don't know if it creates comfort in the office, but it's like, I've seen so many bums just in, my practice that like, no one's is like, it's not, yours isn't special. Like, it's like, we don't like remember and we're like, oh, that guy's was this, or this woman's was that, it's like, this is what we're trained. Our eyes are trained to evaluate this. And yes, it is a sensitive area and people should always be respectful, always ask if they can examine, always keep you alert of what the exam, and if anybody says no, then they should stop. No one should ever force you to have an exam. But, that is part of your GI tract. It is worth getting an exam and finding out that it's just hemorrhoids. That's something that we can easily treat with a surgery. And that's kind of how I would encourage people.
Awesome. Thank you very much. For those of you who are watching who you know very much so that you should be seen and evaluated, there you have it. Make that appointment because your life, your well-being depends on it. So that's good. Yeah. All right. Thank you so much, Doc. I really appreciate you taking the time this evening. I know you're busy, so thank you for coming.
You as well.
And for those who are watching who are like, I like this doctor. She's in Texas. I'm in Houston. And they would like to connect with you, maybe to have you come talk on their platforms or to connect with you as a patient. Doc, where can people find you?
Yes, thank you. So again, I'm in Houston, Texas. My practice is called Houston Community Surgical. Right now, my office is located in the Bel Air area of Houston. Soon to be, hopefully, my office will open in the Heights. They can call, when they go on the website, the phone number's there. They can call or text, and there's no phone trees, which was my desire for this practice. So
Awesome.
you'll get a
Awesome.
person. We can make you an appointment. For patients that need screening colonoscopies, I will often do telehealth, so you can just do it from the comfort of your home or your desk. You don't even have to leave work to schedule your colonoscopy. So I'm happy to do either.
Awesome, awesome. Thank you again for doing this. This was fun. I learned a lot.
Yeah, thank you so much. Happy to talk about the bum anytime.
So we'll do this maybe in a couple of months, 6 months. We'll talk something else GI related, and encourage people to get the screening. A lot of people are like, yeah, I don't want to do that. They're going to look at my butt. I don't want to do that. I'll wait. You don't care. You don't even, that's not an issue.
Take the best nap. It's like the best nap.
I know. Colonoscopy was I actually asked for 15 extra minutes. So like, can I get 15
exactly.
It was so good.
Than that. Yeah, exactly.
Oh my gosh. But thank you again. And to our viewers who are watching, thank you so much for watching. Sorry, I can't tell who's watching right now to give you a shout out, but I appreciate you for watching. As always, caring is sharing. Kindly forward this video, comment in the, or tag a friend in the comment section, because this can help save a life. And on that note, if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician that will have conversations like this to help you live long and well, you know it, I'm she. Have a good one, everyone. Thanks so much, Doc. I appreciate
Bye, thank
you.
you.
Bye. All right.